Hello, for my psychology and film project, I chose to analyze the movie Black Swan. In Black Swan, Nina Sayers is a dedicated and perfectionist ballerina in New York City. The setting is a competitive, intense, disciplined, social world of professional ballet. The competition is, like her drive, is to play the leading role in Swan Lake, which is the Swan Queen. It creates a psychologically stressful and emotionally intense environment. Nina experienced schizophrenia and related psychotic disorders such as delusions and hallucinations. Schizophrenia has a lot of stigmas and stereotypes, such as being crazy, unpredictable, scary, and dangerous. This is really sad and unfortunate for people who struggle with it because it leads to discrimination and isolation. From the article comparing Germany and Tunisia as my empirical article for this slide, in Germany, participants responded with more fear to someone who had schizophrenia versus someone who didn't, while in Tunisia there was more of a stronger response to people urging people who had the condition to pull themselves together. So it was more of like a moral blame situation. Evidence. There are a lot of factors contributing to Nina's schizophrenia, such as intense stress, competition, and internal psychological conflict. According to the DSM, schizophrenia spectrum and other psychotic disorders include schizophrenia, other psychotic disorders, and personality disorder. They are defined by abnormalities in one or more of the following 5 domains: delusions, hallucinations, disorganized thinking and speech, grossly disorganized or abnormal motor behavior, and negative symptoms. In this movie, Nina experiences a lot of delusions and paranoia. She starts to believe that one of the new dancers, Lily, is trying to sabotage her and take the lead role away from her. She also hallucinates a lot and sees other characters in the play behave differently or do things that they didn't actually do. Seeing her reflection move independently, feathers growing out of her skin, stuff like that. As a result of all of this, she breaks down and experiences insanity, and it causes her to self-harm a lot. However, Black Swan really over-dramatizes and emphasizes symptoms of this mental disorder that is not a picture-perfect example of it. Nina Sayers also does not demonstrate lack of emotion, a flat tone, or cognitive deficits. According to an empirical article, some positive symptoms, such as delusions or hallucinations and formal thought disorder, these are actually linked to deficits in both cognitive everyday functions and socio-emotional executive functions. This evidence suggests that there is a strong tie between disorganization type positive functions and executive function deficits. Treatment. So I would begin with medication to reduce hallucinations and delusions, and psychotherapy to improve reality testing and emotional regulation. Because she shows self-harm and a lot of psychological disorganization, it would be really good for short-term hospitalization. Her primary symptoms are psychotic and not personality-based or trauma-based, so antipsychotic is the best evidence-based treatment. Psychotherapy is appropriate since it helps to improve insight, reduce stress associated with the hallucinations, and address the intense stress and perfectionism that is the cause of her breakdown. And hospitalization is appropriate since there is risk to self, loss of reality testing, and self-inflicted injury. The article's recommendation is that combining medicine and therapy really improves overall functioning. And then Nina faces several obstacles to receiving proper treatment, such as ballet culture stigmatizing mental illness, her overbearing mother, and her director exploiting her for artistic gain. Broader perspectives. The portrayal of her disorder in Black Swan is only partially accurate because it reflects actual symptoms very overdramatically, and more broadly, the film strongly shapes the public's understanding of mental disorders. Since most people rely on media rather than understanding scientific and clinical sources, dramatic portrayals create exaggerated or incorrect assumptions, and this really increases stigma, false information, and really influences societal beliefs, especially about mental illnesses.